So thank you, dear friends. This is a great day. Today we are celebrating that Collegium Medicorum Theatri is joining all these celebrations around the world to say to the population, the voice matters. Please do not forget, we need the voice. We need the voice for communication. We need the voice to work, and we need the voice to express our artistry. So very, very welcome, everybody. And we have a very nice program. I hope you enjoy that. We are talking about artistic voice issues with our dear CoMeT friends, members. And first of all, we are having Dr. Austin King from Abilene, Texas, United States. As you know, he is the treasurer of Collegium Medicorum Theatri. Then we shall have the presentation of environment. And of course, we are having also environmental influences and allergies. And then we shall have Alfonso Borragan talking about hydration and voice. Our dear Isabel Garcia Lopez talking about how to keep the voice healthy. And then after that, we have an interview that I made to Maestro Ramon Vargas that everybody knows perfectly. So I hope you enjoy very much. And we shall have a small, short time for questions or discussions or comments that are very welcome. Unfortunately, Maestro Ramon Vargas cannot join us because he is at the moment singing in somewhere in Europe. I think he was in Hamburg and then he went to Moscow and he comes back to Germany. But anyway, we shall enjoy this CoMeT Day for World Voice Day 2023. Thank you very much for being with us. Okay, we shall begin.
Hello, my name is Dr. Austin King, and I'm here to welcome you to World Voice Day. That's the day that medicine is set aside to celebrate the human voice. And like so many other things that we have, we sometimes don't appreciate what we have until we lose it. Our voice really reflects, in a way, even more than our appearance, our emotions, our personality, what's going on in our life. And so what I'm here today to do is to talk to you about when that begins to fail. And there are normally three different problems that occur that cause voice problems. The first is trauma. When we're yelling and screaming at our favorite team member in our football field or basketball player, we're over singing and we get that hoarseness. The second is infection. When we have a cold or upper respiratory infection and we begin to get hoarseness. And the third is when we're exposed to pollution or different problems in the environment that irritate our vocal folds. All of these are temporary and gradually go away on their own without even any treatment normally. But occasionally we will have something that's very serious with our voice that will permanently affect the voice or even be life-threatening. And so how do we separate the more common problems that will take care of themselves from the very rare, more serious problems? So I give my patients really two recommendations. The first is if after 2 weeks your voice problem is not progressively improving, then you'll need to see somebody. And the second is if you're stressing the voice, either yelling and screaming at a football game or over singing, and you suddenly get pain and severe loss of voice, and sometimes that can be from bleeding in the vocal fold, and you need to see someone for that also. So I would highly recommend that you see what we call a laryngologist or ear, nose, and throat specialist. These are physicians that by using a mirror looking down the mouth, or sometimes using a small instrument called a fiber optic laryngoscope that can be inserted through the nose and back behind the palate, they can directly visualize the vocal folds and more accurately tell you whether this is a common problem that will go away on its own or something that's more serious and needs to be further investigated. So again, welcome to World Voice Day, and hopefully you'll never ever have to use this advice. Thank you.
Thank you very much, dear Austin. Unfortunately, he's also in a special trip and he could not join us, but as you see, he has sent his voice, his presence, his knowledge, and his great experience. Thank you very much. So I'm going to share my screen with you and talk about an environmental, one moment, sorry. Environmental influences in the voice and allergies. So today I shall talk, sorry. Okay. So the environmental influences and allergies, as you know, all over the world, many years ago, I think about 30 years ago, the world has begun to talk about pollution. And as we know, there are several factors like meteorological, geographical aspects that we cannot control. But the sources of the human activities have made that with the meteorological and geographical aspects of the world, the air pollution mainly is a great issue for the voice and mainly also for us in CoMeT for the artistic voice. It's also due to the industrial growth, concentration of wealth, motorized transportation, but also, as I said, geographical problems like altitude, mountains, wind speed and direction, intense sunlight, and of course, air pollution is worse in winter due to the thermal inversion. But there are also, as we know, many socio-political issues like private interests, of course, economy, indulgence, ineptitude, political decisions that are not really thinking of the world population and not of our health. So quick improvements need to be done. But in our presentation today, we do know that the personal factors are still one of the main situations in order to avoid problems in our artistic voice due to these influences, but also hereditary factors and also environment. So if the environment problem is going to grow and grow and grow, so the personal factors are going to be in the second place. And we do know that there are a lot of occupational environment problems, mainly in the artistic voice, due to the different stages that they need to share with the artist. And also the climate change is a big issue. As we know, our respiratory system has the main charge of the voice production, like the resonance in the nose and sinuses, the breathing through mouth, and of course the vocal folds and the larynx and the lungs. And as we know, the healthy vocal folds have to be like this, and the outdoors air pollutants, we cannot control them. Sometimes in the cars we can control not to be with so many particles. If we do have a maintenance of the air condition in our car with a filter HEPA, so we can make something, but we cannot do many things about gases. And the particles outdoors, we cannot control them, but indoors, we can control them. Because as we know, in the indoors air pollution are more particles that are going to give the allergological problems to the artistic voice. So it is important to understand that there are two clinical problems. One are the environmental pollution that can give dryness of nose and pharynx, inflammation of all throat and vocal folds mucosa, the thickness of mucus that make us make some efforts in order to clean our throat, and that bring us slight edema in the vocal folds, as we see here. So these small signs or symptoms from the artist can bring more other problems like efforts or like a frustration, emotionally artistic. Sometimes it's very difficult to deal with this problem. As you see here is a lot of dryness and mucus. Of course, another environmental problem that fortunately we have more and more laws about active and passive smoking, but we don't have so many laws and so much education at home, so that that the secondhand smoke combination from the smoke burning cigarette and the smoke exhaled by the smoker, for example, at home with parents, is very difficult to control. And of course, the small children or the teenagers are having a lot of problems, as you see here, this situation. And here you have like what tobacco also can do with air pollution together. So the mucus is thicker, and of course, for a singer, is not so easy. And the problem here, as you see, the worst problem is the Reinke's edema. As we know in the artistic void, these two different problems bring dryness of throat and larynx, secretions, nose dryness, and congestion. This is pollution. We have really a small help with mucolytics. Hydration is working a lot and giving more and more good situations, as we shall see with Alfonso, the artificial lubrication of the nose, and if necessary, voice therapy. For these kind of problems with air pollution and environmental influences, well, it's like a dream. Avoid oral breathing. That means mainly when we are sleeping. That means that the nose has to function properly. Avoid breathing particles. That can be by using high efficiency particles arrestor. This is the air purifier that are commercial, and it helps a little bit. It's not the best solution, but it is the only solution for this. And if possible, not to speak in outdoors area. Humidity and lubrication, and of course, other factors like food and correct voice use. Prevention of particles, as we know, avoid bacterial or viral epidemics as much as possible, control of trash and excrements, and avoid exposure to pollen when you are allergic. And the respiratory allergies are a disease with multifactorial situations. It's not only genetics, it's also environment. But as we know, the environment has been changing through the epigenetics. As we know, the environment has a lot of influence in our genetic code also. So we need to understand that the respiratory allergies are a big problem nowadays, because it's an overload for immune system. Like you see here, there are many allergens that can damage our nose, sinuses, larynx, bronchi, and lungs. And the signs in respiratory allergies in the examination are the edema and paleness in turbinates, mainly inferior turbinates, sometimes with degeneration, polypoid degeneration, sinusitis, mainly ethmoid inflammation, and that brings us to understand why the singer is having a lot of problems in the high tone speech register, because the ethmoidal situation of the sinuses is avoiding a proper placement and a proper projection. The pharynx, of course, with also some other problems. And what is the singer or actor talking about? Nasal obstruction with nasal timbre, change in high tone sensations. Sometimes they exaggerate, as we know, but this is the sense of perception from the singer, that he is taking control of all the sensations during singing. And if he knows that instead of the very good technique, sometimes they have to make efforts to have this brilliance and this high pitch correctly placed. Of course, they have some pharyngolaryngeal obstruction, and the sensation by speaking or singing is worse. And sometimes auditive perception is also a problem. Lack of flexibility, and of course, phonosthenia, lack of brilliance, lack of vocal endurance, and the placement that I have already talked, and change in the pitch quality. In the larynx, as we examine, we see edema of epiglottis with hyaline secretions, change in mucus transportations, as we saw in the other endoscopy. And the vocal folds can have a very slight edema all over the places with increase of mucus. And very interesting is that sometimes we find edema with polypoid inflammation in the anterior commissure. For example, here you have a singer, beautiful vocal folds, but mainly when she's breathing, she has this edema, not only in the body, but also in the subglottal part of the vocal folds. And these problems of allergy can bring us to more pathologies like vocal nodules and cysts or polyps. For example, if you have also this problem in children or yes, children until 12 years old, they can have problems with adenoids and problems with Eustachian tube. We do radioallergosurgevent test in blood, so we can test at the same time many of the allergens, and then we make a treatment with pharmacology. It depends what do we need, taking care that the antihistamines sometimes make a lot of dryness, so it is not sometimes a very good advice. Desensitization and surgical. In the pharmacological, we have antihistamines, some mucolytics, bronchodilators, immunoregulators, and of course, inhalotherapy, at least with water. Vaccines for desensitization is from 1 to 2 years, and sometimes we need surgery from vocal folds, from nose, from ear, and teenagers and children sometimes from adenoids. And it is important to think all the time about our voice hygiene, about hydration, training, about food, smoking, alcohol, drugs, mental health is very important, good sleeping, and correct voice and use with artistic voice techniques. In the protection of the environment, we can be very aware when the public politics are with some ideas of not taking care of our environment. We need to be more active in the politics of our colony or our country in order to have a beautiful voice. And like you see here in Tulum, in the Mayas culture, they were very careful with nature. And we need to be careful with nature. And thank you very much for your attention. And now we kick off with the program. Thank you. Now we shall have the presentation of hydration and voice. Thank you, Alfonso, from Santander, Spain.
Can I share the okay, okay.
Yes.
Here and here. Okay, today is a good day to share the well voice day. The aim of my talk is about the I have a question. Perhaps the best way to hydrate is not drinking water, and the best way for the voice perhaps is in another way, in another kind of take water. And perhaps my presentation is push the idea that we are very happy with the hydration through the nose, breathing in the nose.
You can close the other ones.
The voice has a special magic that can be appreciated when we make art with it. This happens both when we speak and when we sing, but you need one essential thing to be able to get the maximum performance, and is something as simple as moisture. Just like cars need petrol to move or animals need air to live. What happens in the vocal fold when a person speaks or sings? How fast do the chords move? In a man, the movement of the vocal fold reaches between 6,000 revolutions per minute and 30,000 revolutions per minute. But in women, it is between 15,000 and 45,000 revolutions per minute. Not only does this cause the temperature to rise dramatically, but also the friction of the contact surface will be very high. As a result, the risk of injury will be enormous. If we compare the noise of this motorcycle with the noise produced by our voice, we will verify that the motorcycle is not above 6,000 or 8,000 revolutions per minute, and the sensation of maximum work is very high. In normal situations, the vocal folds lives in conditions that can be very aggressive for any engine, and the risk of rupture is very high. We are going to do an experiment to see what happens in our body when we generate friction. If we try to move our hands very fast, we make an enormous friction between them. Heat is produced, epithelial rupture in some seconds, pain, inflammation, and swelling will occur. For this reason, it's normal that this tissue must repair the lesion and produce edema and thickening of the tissues. It is well known that when using a tool that we are not used, for example, a hoe, will cause a callus, and this is what happens in the vocal cord when this friction is produced. But now we can do another experiment and put a drop of water here and say the same movement, and the result of this is that the friction disappears. The high temperature generated by friction and the injury disappear totally while the water is between our hands. In tissue that have been desiccated or dehydrated, the image we see is that they are fragile tissues, that they cannot fulfill their function, and it causes discomfort. However, when they are hydrated, all the tissue is spongy, expanded, and turgid, and this is observed in the human body. Let's take a good look at this phase, and we can see the differences in hydration. It's clear which one do we prefer. It's clear that we will prefer. Hydration of the larynx is easy, but it has some basic principles. If we drink water from a bottle, hydration will be slow at the level of the vocal cords. although this is an important hydration when we seek to benefit for the whole body, but we are interested in to being concentrated at the level of the vocal cords. Breathing through the nose will cause a lot moisture to reach the glottic plane. The goal to put a simple gauze with water, and the goal is to help to the moisture arrives near or in the glottic plane. But the goal is not totally this. The goal is necessary to penetrate inside of the tissue, because it's not is similar to a cream that you put here. If you don't that massage, this cream don't penetrate in the tissue, and this effect of the penetration is produced by massage, and the best massage of our vocal of the voice is produce voice. So it's not only important to have a gauze here in the nose, also it's very important to speak, to sing with the gauze near or cover your nostril. Here here we put a gauze in the nostril, the change and the tissue change a lot. For 10 minutes, breathing through the gauze. And the result is in this case, we can see the contact of the vocal fold. We can see also a small sulcus, or a small rupture of the mucosa, and the lamina propria, the tissue is very attacked in the deep layers. But when we put a little water for 10 minutes, the results are excellent in 10 minutes. Is always that that takes this fact, the sensation of being to being well is always very well. In conclusion, we can say that hydration is easy and fast, and the consequences on vocal function are very good. But it must be hydration through nasal breathing. It has lacks a long time result because only 1 second or 1 minute is very short. We need some minutes, 5-10 minutes. The result is the voice change, because it's more easier to produce voice, is more clear, there is much less vocal effort, and the vocal performance is much better. The only way to verify this is to try it out ourselves. We will see how you will continue to do this to the benefit it brings you. Do it and teach it, because it's very simple, and the results in general with our patient, with our friends, is always very, very good. Thanks for your attention.
Very much, Alfonso. And as you see, dear friends, I thank you for the assistant. I say hello to Tom Harris and to Ron Scherer also, and to some other guests. Well, hydration, as we know, is the first very important issue for the environmental factors, for the allergies, and for the flexibility. Thank you very much, Alfonso. Now we keep on with Isabel. Thank you.
Hello, good afternoon, dear CoMeT members, dear CoMeT friends who are connected to this session. Happy World Voice Day. This is because we are here, because next Sunday is World Voice Day and we are celebrating the voice. So my topic today will be keep your voice healthy. And we will start thinking about what things keep the singing voice or the artistic voice healthy. I think there are three main things. One is basic physiological structure. The second one is vocal technique, and the third one is voice care. Let's see what is each one of it. Basic physiological structure is related with the things that that our parents have gave to us. So the things that we cannot change, if we can be short or tall, we can have long or short vocal folds, we can have a very wide palate, and these things we cannot change it. The second thing is vocal technique. Vocal technique is the thing that all the singers and all the professional actors and so on do during one part of their lives. But this is not true, because most singers or most people that use the artistic voice receive lessons or the advice of their teachers during their own during all his life and all his career. And the third thing is voice care. Voice care is the thing that we all singers, actors, and artistic voice users, we have to do during all our lives to keep our voice healthy. Regarding basic physiological structure, there are genetic, of course, things that we cannot change. For instance, regarding aging, we know that some people, for instance, we see it in the skin, that some people, the aging process in some people is different than in other people. And also, for instance, the endurance of the voice, we know how women have less resistance to phonotrauma than men. And this is probably related with collagen, different types of collagen in the lamina propria. Regarding vocal technique, there are many issues to talk about. Of course, many singers, or I think every singer knows how to what is the correct posture to sing. But sometimes, as we see in these pictures, professional singers are asked to adopt some postures that are really out of the what is reasonable for singing, like lying in the floor or dancing in this bar. No. Regarding breath management, is very important for singers and for artists to know the physiology of the respiration, to know about the respiratory muscles and how to manage the breathing in order to have a good voice. Regarding the emission in the larynx, we have to look for a balanced emission, and this emission has to be related with the proper use of resonators to achieve this equilibrium between these two things. Sometimes not enough. We don't talk enough about the ear. and the brain in the voice. So the pitch hearing is, of course, very necessary for singers. And this is in part related with genetics, but also in part related with learning. So we can also improve this with the studies. And regarding the central part of our voice, one important aspect is this reinforcement of self-confidence that it's so necessary for artists, for singers, and for all artists. So we go to last part, that is voice care, that everybody has to do during this whole his or her whole life. So the first recommendation is to be in good health in general. Good health is normally related with good voice. So no big dinners, because we don't want to have laryngopharyngeal reflux that can affect our voice the next day. And as singers, we have to save voice, so we have to avoid to talk a lot when there is a very noisy environment, or to talk a lot of time on the cell phone, or to talk or to sing during the physical exercise. Also very important to speak in our pitch. We all have a natural pitch to speak in, and probably most part of you know about this syndrome called Bogart and Bacall syndrome, because there were two very famous Hollywood actors who had a very low voice, both of them. And nowadays is very fashion to talk in a very low voice sometimes. So if I try to talk in a voice that it's not my voice, I will be sure very tired, and I will have a voice fatigue, and I can have voice problems because of this issue. What is healthy is to have a flexible voice, to move the voice and to change the pitch while we are talking. We don't have to use up the air, so it's not good to use the residual air. We have to breathe during the singing or the speaking in order to avoid excessive contraction of the neck muscles. And we also have to try to avoid to speak very fast, because people will not understand and we have to repeat. Of course, tobacco and alcohol are great enemies of the voice. We can have very severe larynx problems if we smoke or drink alcohol. So this is something that is clearly related with disease, and we have to avoid. Very important, the sleeping. We have to sleep. We have to try to sleep well in a well-ventilated room with no air conditioning, with no heating. We have already, Alfonso has already talked about hydration. So also humidification of the bedroom, and try to keep a healthy environment for sleeping. And there are some conditions in which we should try not to talk a lot. For instance, if we are very tired, we will do more effort to speak or to sing. So we have to try not to talk a lot in this condition. Also, if we are very stressed, this stress can rely on the voice too, and to do excessive contraction of the muscles, and we can produce lesions. And very important, very, very important, at least in my experience, singers many times develop lesions when they sing while they are sick. So if you are sick, if you have flu, if you have a respiratory infection, the best recommendation for singers is not to sing if you are in those conditions. And last but not least, perhaps this is the most important recommendation for the general population is that if you have a dysphonia for more than 2 or 3 weeks, I mean, if you have a cold, it's normal to have dysphonia for 2 or 3 days. But if you have a longer dysphonia, or if you have repeat episodes of dysphonia, you have to go to visit a laryngologist or a phoniatrician or somebody who can look at your vocal cords to make a diagnosis, prompt diagnosis of vocal fold pathology. This is very important to know for everybody, not only for singers and actors, but also for the general population. And that's all. Happy World Voice Day. Your voice matters, and thank you for your attention.
Thank you very much, Isabel. And as you see, dear friends, the situation is very important for keep the voice in a good situation for the artist, but also for all the world. And this is very nice that we have all these presentations, because even though there are many of our CoMeT members who are experts on these issues, we shall hear Ramon Vargas, who is one of the greatest tenors nowadays. He is very active at the moment, and I am sure you have heard him. He is a great tenor, and I have the honor of keeping him as in a good health as much as possible, but many of our CoMeT members have seen him also in other places. And we shall have this interview that I made to him. I wanted him to be live with us, but perhaps in September or October, he shall share with CoMeT members in one day, like Francisco Aranza did. Thank you very much. And I say hello to Iris and Carles. So let's hear the interview from Ramon Vargas.
So this is great to be here today. It is an honor to be sharing this Zoom meeting with our dear, dear Maestro Ramon Vargas. As you know, he is one of the best tenors, and his music is such a wonderful artistic expression of the emotions and the feelings that we are very happy to share with him Collegium Medicorum Theatri World Voice Day 2023. Welcome, dear Maestro Ramon Vargas. Where are you now and what are you singing? Please tell us.
Thank you very much. Well, actually, I am in Hamburg, in Germany. I am singing Simón Boccanegra. Gabriele Adorno is my role from the Verdi's Simón Boccanegra in this magnificent theater in Hamburg. And yeah, yesterday was my performance. I am very happy to be in touch with you. And congratulations to everybody. Thank you very much, Maria Eugenia, to invite me. Thank you.
Thank you. Dear Maestro Ramon Vargas, what do you think, what is the voice, the human voice? For you, what is it?
The human voice is everything. The human voice is the way to express our emotions, the way to express our life. And I think the voice is such a magical way to communicate between the human beings, because we can use speaking, we can use singing, and we can use in maybe another ways that we can express our life and our emotions. And for me was absolutely important and fundamental, the voice in my life, not only because I am a professional singer, but only because was the way how, when I was a child, was the way how to be in balance with my emotions also. When I was too shy, and then the way to balance my personality was through the singing, and could be also a medicine. In this case, for me, was like a psychiatric way to work with my voice, because I was too shy, and when I was singing, I feel comfortable, and then I was balance my personality. Fortunately, was working in that way. Could be not in that way. It could be that would produce more frustration for somebody, but for me, it was good. And then I speak about myself, and that was a great experience for me, the singing on all my life, and to use the voice in that way.
And this is wonderful what you are telling us, because the experience with music and with singing since the very early age of all the children is very important, because we are, as you said, expressing emotions that sometimes are very hidden in the bottom of the soul and of the thinking. So I think this is very important for the general population, that the children get in touch with music and with singing since the very early time. For example, you have the experience in the Mexican music and in the with the Mexican great composers and great popular singers like Agustin Lara and like so many composers. What is your experience in the first ages of your life, dear Ramon?
It was very important because I think when I was child, this was developed this music, and we have in Mexico a lot of nice composers, good composers. And we have also the influence from the American or from the English bands. And when I was child, for the rock and roll, we were there in this period that was, but the Mexican music was strong, and we could stay singing our nice melodies and our way to express the Mexican emotions, the Mexicans' attitudes also through our music. And then I was child, and then I was involved in that kind of music with great singers as Pedro Infante or Jorge Negrete or Javier Solís or Pedro Vargas. The people who was confusing me with Pedro Vargas. Pedro Vargas was my father, they says. And then something as that. And then I think I have this fortune to be in touch, in contact with that music when I was very young. And then also with the religious music when I was in the chorus in the Basilica de Guadalupe in Mexico. And this was a professional chorus. And I started to sing when I was 10. We started to sing a lot of motetes, a lot of Gregorian music, and Palestrina, Tomás Luis de Victoria, composers. And that was absolutely fantastic for a child to have that music in so early time. And I am absolutely sure that was one way that touched my soul. And then when I start to sing as professional singer, I have also in my mind that beginning of the music, because the music started with the Gregorian music. And I studied that when I was a child, and then this developed such kind of sensibility that is different, as it's only coming and singing loud and make effects for the public. And you go through the music also to another, maybe high-end stadiums of the music. Is what I think. I think that to be prepared in the really deep prepared in the music helps for everything.
Yes, as for the general public, Mexico is a country with a lot of artistic traditions, with great composers, with great singers, and we are celebrating all the time with music and with singing. So that's why we say everybody in Mexico is singing, perhaps in the shower, perhaps they don't sing properly, but everybody is singing. And for example, we have composers for children like Cricri, Francisco Gabilondo Soler, and some others that are really a great influence for our children. But also you had the possibility to hear some of the most famous popular singers, like you said, Pedro Infante, Javier Solís, Jorge Negrete, Pedro Vargas, and so on. And at the same time, you develop the hearing influences in the brain through the classical Gregorian singing, and of course to sing in choir was also very important. So for the general population, music and singing is very important for all the human beings in order to develop not only musical capacity for singing, but also for the brain development to discriminate the different musical phrases, and also for the ear. We celebrate also World Voice of Hearing, and this is important for everybody. And what happened after that in your career with the great help and influences and direction from great teachers like Antonio Lopez, like Maestro Nieto, like some others that were in the Instituto Cardenal Miranda?
Yes, when I was there in Mexico, I was studied very hard. I was with a lot of discipline, and then I won the competition, the famous Mexican competition, Carlo Morelli, in 1982. And after that, I realized that I should prepare myself and go out of Mexico, because I think it's important for all the artists to have an influence for another cultures. And then I went in 1986, I went to Milano in Italy, to Milan, to make also a competition, Enrico Caruso competition, that I won also this year in 1986. And then I never come back to Mexico. I stayed in Europe for the rest of my life until now. For circumstances, that means I was not prepared to come in. I was not decided. That means the circumstances make me to stay here in Europe. I won the competition. I went in the opera studio, in the program of the opera of the Vienna State Opera. And then I received my first contract in Lucerne in Switzerland, and 2 years later, and I started my career there, and I stayed in Europe for the rest of my career until now. And but what you say is very important. I think for singing, you need to have something clear. And one, especially if you are a professional of the singer. If you are not a professional of the singer, you have to take care of your voice in any case. But if we are professional of the singing, we have to take special care, because we are athletes. We are the athletes of the voice, but we very few times we take care of our voice as the athletes make themselves when they are jumping or boxing or playing tennis or whatever. They take a special attention on the technical and also the body and the physical circumstances that could help them to be better and better in this discipline. And this is exactly what we don't do. We, the singers, we don't take care for our instrument that is so delicate, so unique. The vocal cords are small, and they are very delicate. We have to take care of this both small thing with all the careful and all the body and all the physical, the nutrition, the body in general, our lungs, our stomach, everything is connected here. And our emotions, everything. And then I think we should take care and make 24 hours care of our instrument.
Yes, you are perfectly correct, dear Maestro Ramon, because we can consider the whole body as the packing of the instrument, but we cannot take the instrument away from our neck, where the larynx, where the vocal folds are working so hard. So we have to understand, as general population and of course as professional singers or as professional voice users, that you need to take attention, to pay attention to all the details. How is your sleeping, for example? How is your posture during the day? How are you breathing? Are you breathing properly through the nose, or are you having breathing problems because the nose is congested with allergies or with septum deviation or whatever? If you are eating properly, and at the same schedule, if you are having some reflux, that means acid that is coming to your vocal folds, even though you sometimes don't feel any reflux, but your vocal folds, they do complain about this reflux, and of course about the technical things. The technique in singing is very important. And it is understandable because we want to have the optimum from this artistic capacity of each professional singers. So in your experience, in your career, dear Ramon, what could you comment about the repertoire, about the composers, about the way of the singer in front of the great composers? I would like to sing like Maria Callas, me myself, but it is not possible because I am not Maria Callas. Please tell us some of your experience.
I think, Maria Eugenia, that what I think is that everything maybe is condensed in one word, in one phrase, that is the secret to be success in our profession. It's exactly the same example. And then I don't think it's a good idea if you're a medium heavyweight to go to a heavyweight, maximum heavyweight, because the other guy is really big and he will be too strong. And that happens exactly for us in the same way. That means one composer as Richard Wagner or Berlioz or not only Shostakovich or so, they wrote very heavy for the orchestration, and they put a strong and big orchestration, and your voice has to be there. And then what's more, the new instruments are brilliant, or before they are more brilliant as before. The orchestras are big. The maestri conductors, they like the sounds more as before, and everything is against the singing. Everything is against the voice, and we have to take care how to use our voice with intelligence and with sensibility, because it's not only the coming and singing loud. That means the voice has to express emotions, not only loudness, not only sound. And that is a problem, because sometimes the people prefer the sound as the emotions. And for that reason, I think that the voices has to choose what is better for them. If your voice is better singing the bel canto style, Rossini, Donizetti, Bellini, sing in that way, sing there. If your voice, for example, for me, my voice now actually, because I have a long career already, more than 40 years of career, my voice was moving from Mozart until Verdi, some roles of Puccini. But Puccini, I like to sing Puccini Bohème, for example, but I don't sing more things from Puccini because my voice is not in that direction. My voice is more for Verdi. My voice goes more telling the words and using the sounds and the colors, and not more for the power of the voice, because my voice is not powerful in that way. And then I don't have to I don't have to fight against that. I have to use that as a characteristic of your voice. Is that you are tall or you are shorter. It's the same. That means you are that. You are tall, you can play basketball. You are short, you can play another stuff. And then for me, is I am. My voice is that characteristics. I use it my best way, and then in that way I survive for more than 4 years singing. And then I think it's very important when I says, I think the most important is that you know your instrument and you have an idea what you want to do and how you want to use it. And if you know that, you know, you are conscious about that, your career could be longer.
Yes, and this is very, very interesting after your long career, the balance that you express now about technique, health, emotions, and you have to be prepared to say no to some productions, even though they are very attractive. But sometimes you have to say, I am sorry, I cannot. Or in the daily life with the family or with friends or with fans, everybody is after you singing, after you talking, and of course they want to give you many souvenirs, and sometimes they are expecting from you that you sing in a not correct way, in a very harmful atmosphere, like open air or something like that. So you need to be prepared to say, I am sorry, I can't. I do love you, but I can't. Tell us, Ramon.
Oh yeah, and I think that is the people sometimes doesn't understand that. It's I could understand maybe in some way, but no, they want that you, because you have your instrument, you have singing whatever. No, it's as you says to Bolton. Do you want to make a competition with me? We run a little bit. What happens together? And I said, no. Yes, it's only here. In the, you can run a little bit. You are the best. You are the most. You are the most incredible athlete. You can do that also. No. I don't think nobody will ask something like that. But for us, yes, because please sing something. You can sing something. Something easy like Turandot, he says. Well, you don't sing Nessun Dorma. Nessun Dorma, okay. Yeah. That means the people listen that. we have to take care. What you says is right. But I think the most important thing is that the conscience that we as singers we have with our instrument. And because it's the International of the Voice. And I think it's not only for the professional people, I think for everybody, we have to take care of our voice. I see people that speak bad. I speak people that have problems with your vocal cord because they don't know how to speak, or they speak too loud, or they speak in word. And then it's incredible because the people can damage their voice also if they are not singers. It means it is important to have a healthy voice for everything in the life, because it's one important organ of our body, and it's important. Of course, that the professionals is even much more important, because it's our way to live, but also for the other people, I think.
Yes, I agree with you. This is the human voice is communication. And if you have a healthy voice and a flexible voice, you can communicate to your children, to your family, to your employees or your work. You can communicate better. And there are also many speaking professional voice users like teachers, leaders, religious leaders, politicians, and also in the call center.
Radio. Chronist.
Yes. And then you come to the artistic voice, the speaking artistic voice with dubbing or actors, and of course, the most important and finest and detailed expression of the human artistic voice is the singing. So we talk about hydration, we talk about the health of the respiratory tract, like nose, sinuses, of course, throat and vocal folds and lungs. Now with COVID, we have many problems, and the digestive health, and also to maintain a proper, you said it before, Luciano was not having a proper health in his body. And this is very important that you don't have overweight and you have training in aerobics exercises, and of course the general emotional health and mental health. And there are so many professionals that can help all the voice users and all the general population. But this year, Ramon, our World Voice Day 2023 phrase is "Your voice matters," because your voice is giving you all these details that you have already said: communication, work, emotions, and art. What would you say to our Collegium Medicorum Theatri group that, as you know, these are the expertise from all over the world about we are handling the artistic voice, and I am very honored to be one of your medical doctors that we are with your hand all these years.
The first thing I have to tell them is thank you very much, because you are absolutely important and you have a mission in this life, not only take care of and cure and the voices, but also you have to communicate, to educate the people about that. And then thank you very much, because you are basic and important. Fortunately, now in our time, we have more communication as before. We can obtain information, but now the most important is to obtain the best and the really right information. And you are very important for that. You are basic, the fundamental people in our job. And thank you very much.
Thank you very much, dear Ramon. I know you are coming very soon again to our dear Mexico country. And well, we hear you, we delight with your passion, with your flexible voice, with your way of musicality that we completely admire. And we thank you very much for your time. And we love you dearly. Everybody loves you, and me especially. We have been together in many difficult situations, and we are together all the time. Thank you very much, dear Maestro Ramon Vargas. And for Collegium Teatri, this is a special sharing for Maestro Ramon Vargas. Thank you.
Congratulations.
So thank you very much, dear Maestro Ramon Vargas, because, well, we talk from one point of view, but we are a team, and the medical doctors that have studied all the physiology, all the clinical situation, pharmacology, of course, anatomy, and we hear that also the artistic voice professional users like the singers like Ramon are sharing with us from another criterion the same situation. It's great for us, but also the situation of our group. In our group, we have voice scientists, we have vocal coach, we have singing teachers, and Collegium Medicorum Theatri, well, is now 53 years old, almost 54. And this is great to have heard Ramon about what is the voice for him, what is his career, what he thinks about so many interesting things. I thank you very much. And I would like to open the questions, please, through chats. I don't know if some of the CoMeT members want to say something. Alfonso, Isabel, and the other CoMeT members who are sharing with us. Do you want to comment something before we go to the questions and answers of the chat? Yes, Isabel? Okay. Somebody wants to say something? Well, the questions, there is a comment from one of our assistants, from Lina, that she is interested in hearing about the plants. My experience about plants that we use in nebulizations or inhalations, or that we are making gurgles and things like that, is not so easy for everybody to use the plants just like that, because, as we know, there are allergies for the plants also. And the plants, just like there are families. For example, chamomile, this is a very usual tea, belongs to a family where you can have allergies. So I think the best thing is to be as neutral as possible, and to experience yourself with your medical doctor and with the knowledge of your own body and your own respiratory system, what is the best for you. Because, for example, Savila is very good. Of course, apple is nice, but there are allergies for apple also. And there are many situations that can be helpful, but we cannot advise to everybody to use ginger, for example, because ginger irritates also the stomach mucosa. So there are many situations that we need to be careful with. And also, for example, if you have some of the medicines that we use, sometimes the medicines can also make side effects like dryness, even though in the pharmacology we study that the main effect of a medicine is, for example, mucolytic. We have the experience with the singers that sometimes this mucolytic is not working properly in some of the cases. And for example, if you have some food allergies and then you mix some medicines with this situation of the food allergies, then there can be a problem. I remember very much one case, and it is public, that's why I tell you, that Ramon was singing El Trovatore in Bellas Artes in Mexico, and I was hearing him very, very nicely. I went in the intermission to see him, and he was perfect. He was, with his wonderful voice, he was perfect. And suddenly, after the second area, they announced that Maestro Ramon Vargas could not sing anymore. So I went immediately to his dressing room, and I said, "What happened?" And he had no voice. The problem is he had a food allergy that he didn't know about that. So somebody else came and sang Il Trovatore until the end, but it was after 1 hour of medicament and medicines that he got his voice back. So that can happen with allergies when we do not know. So it's important to be careful with that. If you have your own knowledge of your body with your medical doctor, with your vocal coach, with your experience as singer, this is good. But there are not formulas that we can use for everybody. We can say, yes, water is perfect, hydration through the nose, through the mouth, okay. But sometimes if we use medicines or we use plants, we have to be more careful. And I don't know if somebody wants to ask something else. Yes? Yes, Ron, please.
Yeah, actually, I have a number of questions, but I won't ask them all in one string here. First of all, by the way, I think that the interview aspect, that's a really great idea. I think because CoMeT, especially if we have more CoMeT members on the matrix here, not everybody is an MD, not everybody sees famous people all the time. And so it's a really good idea to know more about the really famous people, especially if they've gone through many difficulties that they don't mind talking about and sharing, and gives us a little bit more perspective on everything. And it's it's always the case that famous people are just normal people too. That's always good to see. So thank you for the interview. I think we should do more of that. That would be a great added feature to these, at least the Saturday meetings. And just another, before I get to a question for Alfonso, actually, I did not know that the Bacall voice was still around. We lived through the Bacall voice a long time ago, and maybe it's slow and got over to Europe and still in Europe. I'm not sure what's going on there, but we don't hear that too much in America. I don't think. We don't talk about it too much. We have other problems, but that was pretty funny, Isabel. Well, moving on to, I actually have a couple of important questions for Alfonso and the group. Ever since I started thinking about and working with voice science and all that, we always thought that when the vocal folds came together, there was a really good chance that there would be a shearing force, which would be a rubbing force. So if the folds came together and displaced themselves just a little bit, that would be a little rubbing. And it seemed logical that at the vocal processes, especially for like granulomas, at the, at the contact areas, varying a little bit, there would be a little bit of displacement, a little shearing, thus rubbing. And I have never seen, though, high-speed video showing that sort of contact with shift that would be that shearing, rubbing kind of force. So my question is there actually any evidence, except maybe from any evidence, even for asymmetric, height or whatever, is there any evidence for the concept of rubbing or contact shearing forces of the tissue when they come together? Not internally. There's a lot of shearing internally with vibration, but contact. There you go.
Yes, Alfonso. Alfonso, the microphone.
It's a very nice question, Ron. Thanks. I think RAB is all the friction is always a question very difficult to understand for us, because our stroboscopy is not real, and so we can imagine the things that happen, but perhaps is different, the real situation. And when we see or we analyze a video at high speed, is not simple for us, for our view. But I think one variable is not, in general, is not present in our minds, and is the temperature. The temperature is very, very important. I would like to measure the temperature in the vocal cord, and perhaps the temperature in a high tone, perhaps the temperature is 40 or 42 or 43 sometimes. And in this case, the lesions, the micro lesions, perhaps will be there. And for a minimum microlesion start many other problems. So I think friction perhaps is important, but perhaps more important was this fact of the temperature, that is friction also.
We actually we took an excised larynx. We put a thermistor inside the vocal fold and had the vocal fold vibrate to measure temperature increase in the middle. It was probably in the muscle, And it actually, after a while, went up about 1 degree centigrade. And the joke in the lab was that we were on the trail of vocal fry, in the sense of frying in a pan or something. Of course, that was just a joke, because it had nothing to do with vocal fry. So yeah, the temperature increase of the temperature inside the vocal fold is quite important. And that's where the hydration, movement of blood, nutrition, etc., must be really important to carry away heat. But this would be a really great research question, wouldn't it? Surface, the concept of surface shearing, and maybe 10,000 frames a second would do it, or having having some sort of device on the surface so you can actually measure a shearing kind of thing. Maybe take a large larynx first or something. But it's a really important concept for modeling and for understanding. One more question for you, then I'll let somebody else, and then we'll come back if we could. When you use the gauze, do you just use water, or do you use saline, or some, dip it into some fluid that is best for inhalation? Alfonso.
No, we use a normal gauze, that the medical gauze, because this has a net, perhaps has
Yeah.
a net. Here the water is in the middle of the net, and the idea was, when some patient says me, I speak or I sing very well when I am or I have a shower. My voice is marvelous. And this idea of to put the vocal tract in a atmosphere of 100% of humidity, was the idea when we start to experiment with this 25 years ago. And we use this for thousands of patients, or not only patients, public in general, because when I speak in a lecture, in a talk, I do experiment with people, and also push to do that, because it's an experiment that produce a good feeling of the voice. And when we use this, the water is we use only water, simple water, and water of the of the tap, not mineral water, because the idea is to put or to try to the water can arrive in the vocal cord. The second thing is this water that tends to be together, and not the water not spread, because his normal tendency is to be together, to be in a drop.
Yeah, that's good.
And to break this, we need a special fact that is surfactant,
Right.
or to do a surfactant effect. Speaking, or perhaps with phosphatidylcholine lecithin, we do that.
Oh.
But for us is the only substance that we use to do that, because the surfactants that is a normal there are surfactants in all the mucus, or in the bronchus, in the all the surface of the lung, or bronchial surface. Always there are, the mucus is not a surface, are two surfaces, one very liquid, another very more dense, and between them, to compact them or to attack them, there are always a surfactant, and is a special, is a surfactant. I don't know very well what is the surfactant, but we use, to do that, we use the surfactant that has in the lung, in the alveolus. We use the phosphatidylcholine. And the third fact for the water is, try to that this water that is here in the surface, that penetrate. This is the most important, because if water is here in the surface, the results are not good. But when we try to penetrate, or we find penetrate inside, and has taken for the hyaluronic acid the miraculous that start to move the tissue much better. It's incredible. The physiology of the hyaluronic acid is incredible. It's incredible. And when we put water, is to speak with the hyaluronic acid. Is not to put water. Put water? Oh, yes, but it's speak with this hyaluronic acid, because only 1 gram of the hyaluronic acid, only 1 gram, take 1 liter of the water. Incredible, incredible. So we must not change the ideas of the hydration, but we must to deep in the hydration, because hydration is very big, is bigger, or the power of the hydration can be very important.
Thank you, Alfonso.
Yeah, well, one final comment. I think that we just need more shower scenes in opera.
Well, thank you, Ron. Yes, I wanted to add something, because I have this experience of hydration, and I have been talking about hydration for many years, because mainly in Mexico City, we have an altitude of 2,200 meters above sea level, and our humidity, almost all months of the year, only when it rains is okay. We have 20% of humidity in the atmosphere, so this is very dry. So I was all the time, 30 years ago, I began to make all the nebulizations. Also, I have a recipe from Dr. Perello, and I have also the experience from Professor Wolfram Seidner with tacoliquin and with the Bepanthen and with some other medicines. But usually I only use water. If possible, I use also some other surfactants like tacoliquin. And I also use the recipe from Dr. Perello, because he was investigating many things, even though he was in Barcelona, as you know, also CoMeT member. He was investigating what happened in the vocal folds when they used this recipe. And the recipe is mainly 2 drops of eucalyptus, 2 drops of menthol, 2 drops of benjuy. And okay, sometimes it works properly, sometimes not. But I use hydration and nebulization not only through the nose, but also through the mouth. Because as you know, if the turbinates, inferior turbinates, are very grown, are very big, they stop all this fluid that come to the vocal folds. So I use both. And I remember the wonderful modeling run from Erky Wilkman about hydration in the modeling of the vocal folds. Also, Kitty Berdolini made some wonderful experiments, and also the Japanese group. I don't remember exactly the author, but I have that. And they show, mainly Erky Wilkman, they show, because Finland is also very dry, they show how are the situation with all the vocal folds. Of course, Erky Wilkman at that time didn't have any high-speed possibilities. So I think this is a very important issue, what you say, Ron, and what Alfonso is making, and also what we have the experience, and also in Charité, they have all this experience with nebulization. Because we are in a air situation, we are breathing air, and the air is sometimes not the proper air. And the hydration, the dehydration, is very, very, very intense in some stages. For example, the singers in Mexico in wintertime, we don't have any heating system, because usually we have good weather. Now we don't have so much good weather, we have extreme weather. So they are singing in cold atmosphere without any heating system, and this is not nice, because we know that the cold weather is coming to the vocal folds, and there are physiological changes about us. I don't know if somebody wants to comment about this. Hello, Tom. I'm happy you are in panelist. You were all the time here. Jacobo, you want to say something about hydration? No? But Ron, you are completely right. We have to keep on working, Alfonso and everybody. Yes, Jacobo, yes, Tom, you want to say something? Your micro, Tom.
Okay, is that all right? Yeah. We sometimes seem to forget that the waves that we make to make noise, sounds and things, are always a function of the energy source coming in and the way we've created the resistance to make the waves. You can watch this anytime you go to a surfing beach. You know, the wind going past it, just like a voice, is the one that sets the waves up. But what makes them enormous and efficient is the structure of the beach and what gets in the way. And how we create that can make damage and, you know, sort of quite different if we don't get the slope right, if you like. I mean, this is an oversimplification, but it's always making voice just the energy source and its interaction with the available geography as to whether there's damage being done or whether people like to ride the wave. But we can't just cure, you know, a bad day at the beach, you know, on the pipeline just by getting them to inhale, you know, inhale water. A lot of them are inhaling a lot of salt water one way and another. Doesn't do them any good. And so you can't isolate. You have to look at the whole problem of the way people are voice producing. And it's very interesting. It's not just musicality. It's being fearsomely efficient with the voice you've got, which may make it sound grand and terrific. But the very best singers tend to be very, very vocally efficient. And if they fall off, this is a catastrophe and it's unusual.
I think,
Sorry, I get troubled about the sort of the input versus the structure and the anatomy of the whole thing, because it's an interaction at all times.
as regards, I mean, excellent comment.
Yes,
Excellent comment
yes.
from, yeah, excellent comment from everybody. I think the topic of hydration really, it's a very big one. And one thing that I just want us to be cautious is that we mustn't think that the gauze or the nebulizer is a replacement for drinking adequate water. I think it should be seen as a supplement to the normal rehydration that you need. You know, if you need X amount of water, especially in a very dry climate, I think you're going to need that physiologically as well. So that should not be replaced by the gauze or whichever nebulized method that you're using. I've often come across singers who came to me in the clinic, and with the technology now, they have like a portable, almost like an inhaler. It's a nebulizer, electrical with batteries in it, and they can just vaporize lots of mist of saline actually coming through that. So they get lots of nebulizing or humidification with that. I don't know what your views about that, whether you've experienced that with any of your singers using the portable humidifier, you would call it, or nebulizer.
Jacobo, yeah, I have the experience, for example, with singers like Ramon and Francisco and that are traveling all over the world. They have their personal nebulizer. And I never use, my experience is not so good with saline solution. I prefer regular water, but low warm if possible, because there are sometimes hyperreactivity from the larynx also to the water, and this is interesting. But we cannot also forget that we have very close the esophageal sphincter, and sometimes during singing we have this very, very small amount of acid coming to the arytenoids. Of course, we need more evidence, we need more research, we need many things, but we have the statement from the singer that says, when I am singing mainly high register, I feel like more phlegm and I don't understand why. And then we examine at the endoscopy and the stroboscopy, and we see differences. So I remember also in this Japanese group research that they were also examining how are the saliva and the different phlegm coming from the up to the down and to the sides and things like that. And so with the air pollution, the phlegm is thicker and come to the side sometimes, but sometimes come to the middle of the vocal folds, and it's not so easy. But I think nebulizer is good. Yes, Tom. Yes, Tom.
One last little comment. We've been talking about humidifying folds, which is fine, but nobody's mentioned recently particle size. And if you use an ultrasound, it's fearsomely efficient, but the particle size is so damn small you can drown babies very rapidly. Most people don't get drowned with ordinary steam droplets. And so what you have for convenience, an ultrasound, in your pocket, is not the same. And you can overdo it, and it may be very unwise if you're feeling a bit dry, at the interval and want to go on, rushing in to inhale convenient, very, very effective ultrasound vapor is not clever necessarily. You may get away with it, but it's not without risk.
So, dear friends, I think
it's
yes.
very interesting, this comment of Jacobo and Tom. Very, very interesting. But my experience in this fact, I have a different sensation of the measure of the drop of the water. When the drop is very small, perhaps minus of 5 microns in a nebulization, in a cloud of water, the is excellent for the lung, excellent, but not for the vocal fold. Vocal fold need a drop very high, above all 5, above all 20, 30, and the shower for the vocal fold is better. In our research is better because produce a contact, more contact, and not pass through the vocal cord very fast. Has more contact with the tissue and can penetrate much better. We prefer the shower, or we prefer a gauze that is similar for the measure.
Yes, no, I think that's fine.
Yeah, I think I like
safer too.
I like your gauze technique, Alfonso, because A, it is cheap, B, it's clean as well. And the reason I said this is because just last week I had a patient that came with this portable nebulizer that she uses before singing. They just turn it on. Nice, beautiful mist comes in. But when we looked around the base of the cup, it was full of mold. So you have to be very careful. So all along she's been inhaling mold or fungus, so it can be not very sterile and good as well.
Yes, but we have to think also that sometimes there is sometimes a stage problem. For example, now in Mamma Mia in Mexico, they have many performances, and they need to get the hydration because the theater is very dry and not the cleanest. As we know, when they are dancing, it's a lot of dust and problems. So nebulizer is a good idea. So I thank you very, very much. And I agree with everybody that we need to change experiences, but also to make research about evidence and let's see what is going on in the world, because the world is changing very fast and the voice is completely dependent on the breathing system, and we have the air around us. So I thank you very much. Thank you, Alfonso. Isabel has just gone. Thank you very much, Ron, Tom, Jacobo, Professor Wolfram Steiner. Many, many kisses. And of course, Iris has just gone. And our invited guests, Victoria, Daniel, Lina, Manuel, Naomi, thank you very much. And have a wonderful World Voice Day tomorrow. Bye-bye.
Bye, everybody.
Bye.
Bye. Bye.
And
Bye.
see you
Okay, we won't miss
of
it.
July in our next 16 online session.
Oh, okay.
Right. Bye.
Bye-bye. Thanks.